Welcome back. It's such a simple task. We're supposed to do it twice a day. It plays such a big role in our overall health. We're talking about brushing our teeth. Dr. Richard Aguila is part of the team that makes up Jacksonville Dental Specialists. All right, you guys are known for dealing with some huge, big-time, mostly complex dental cases. And we talk about those all the time. But today, in honor of National Toothbrush Day, we're talking about toothbrushes. And I don't know if West Virginia is watching, but I went to Virginia Tech, and we used to joke that where was the toothbrush invented? In West Virginia, because if it was made in any other state, it'd be the teeth brush. It's a joke, people. It's a joke. It was a rivalry thing between schools. But the toothbrush, one of the things people think, oh, I have one. We get one every time we go to the dentist. You guys always give a new one.
Yeah.
Is that because every 6 months we're supposed to change it?
Yeah, it's actually every 3 months.
Oh, boy.
Every 3 months. So the American Dental Association recommends changing your toothbrush every 3 months. And reason being is the toothbrush actually harbors a lot of bacteria. So as time goes on, you can harbor a lot of bacteria in the toothbrush.
Even when you rinse it out, that doesn't get rid of it?
Even when you rinse it out, yes. Yes. And also the efficiency of cleaning, the toothbrush was made to get into a lot of tight spaces, crevices in between teeth. The efficiency of cleaning is definitely lost after 3 months. So after 3 months, you should change your toothbrush to a new toothbrush.
Well, all right, so I definitely have to do that because I actually have like 3 toothbrushes in the holder there, and one of them is really stiff. And I don't like brushing with it all the time because it's really firm, and after brushing with it a bunch, you start to feel some just tenderness and stuff in the gums and the teeth. But so I shouldn't keep a really soft one, a really firm one. You always talk about the electric ones.
Yes, yeah. So to get back to your first point, you always should use a soft toothbrush because you can actually cause a lot of damage using a medium or hard toothbrush, especially if you're not using the correct technique. Some things that you can cause are gum recession. You can actually cause recession of the gums. You can cause crevices to form on your teeth as well. So a soft toothbrush is always good. For those people that don't have good manual dexterity, an electric toothbrush is very good. Okay, they have timers. You basically just allow the brush to get into the places where it needs to get. So electric toothbrush is a good option for those patients that just can't get into tough spaces. So we advocate, electric toothbrushes as much as we can. There's some good ones out there like Oral-B Braun or Sonicare. Those are the 2 that we advocate in our practice.
Kind of the old adage, you get what you pay for.
Exactly.
With those things. So
exactly.
Okay.
Yeah.
Now, even if you have that, even if you have the electric one or whatever, and you sit it by the sink, we don't have the equipment you guys have that sterilizes everything that we're using. It sits out on the counter. How do you know if you're handling it right?
Yeah, proper care of a toothbrush, always rinse it after use. And I mean, that's pretty obvious, but some people don't. Keeping it, rinsing it out with either on occasion with peroxide or salt water. Bacteria doesn't like salt or peroxide, so it helps kill that bacteria. Whenever you store it, you always store it in open air, never in a closed environment. When it's closed, it's moist. When it's moist, it harbors that bacteria. So very important you do that. And an obvious one as well is don't share it. Bacteria, again, harbors within the bristles, and it can be transferred to the patient you're
Sitting it in mouthwash? Is that?
Mouthwash is good because
Okay.
it does. Mouthwash is a good option as well. Yeah.
All right. I may have to do that. I definitely have to go to my bag that I bring to work and remove the plastic. I have the plastic case over so that's bad.
I guess as long as air gets through there, as long as it's not a closed environment, it should be okay. The plastic case.
So many rules. I think I have one toothbrush that's over 1.5 years old. That's bad, right?
That's bad.
Okay. How often, when you're giving the toothbrush out at the end, what's the favorite color toothbrush? Is there one?
The most popular toothbrush color is actually blue.
Really?
Blue. Yeah. So guys like blue, and more girls are starting to like blue as well. Yeah.
All right. We got fun facts about the history of the toothbrush. Do you know these?
You can share. Go ahead.
All right. Toothbrush tools date back to 3,500 and 3,000 BC. Babylonians and Egyptians. Natural bristles made of bone and horsehair, only source of bristles until DuPont invented nylon, which was a little bit after that. That's crazy. I didn't know that went all the way back to the Egyptians. First modern toothbrush was made in 1938. Huh. Well, that's a pretty big gap there. No wonder some of the old pictures, everybody smiles with their mouth closed.
Yeah.
Obviously, you guys handle much bigger cases and much more detailed stuff than that. Best way for people to get a hold of you and talk to you about something they need?
The best way is to call our office or refer to our website. You know, as we talk about every month, we have a monthly seminar. Our next one's not until July. We just had one. It's July 19th. So you can attend, get as much information as you can about what we do and what we can provide you with.
All right. Check them out. Appreciate you being here.
Right.
We want to thank Jacksonville Dental Specialists for making this segment possible, and call 904-460-4201 today to schedule a consultation, or you can visit their website to learn more. It's jacksonvilledentalspecialists.com.